Introduction to Concussions and Memory Loss. A concussion is a type of traumatic brain injury that can occur when the head experiences a sudden, forceful blow or is subjected to an intense shaking motion. It can cause changes in the way your brain functions, including damage to memory stores. Studies have found that suffering from a single concussion can affect short-term memory and cause difficulties with concentration and problem-solving, as well as symptoms of depression and anxiety. In severe cases, concussions can lead to long-term memory loss and even lifelong impairments. In this guide, we will cover the research and evidence that links concussions and memory loss, as well as symptoms, causes, prevention, treatments, outlooks, and resources available for those affected. What is a concussion? A concussion is a type of traumatic brain injury that occurs when a sudden impact or force causes the brain to move inside the skull. This movement can disrupt normal brain activity and cause a range of short-term and long-term problems such as memory loss, confusion, dizziness, nausea, headaches, and even in extreme cases, death. The symptoms of a concussion vary depending on the severity of the impact. However, some common signs of a concussion include headaches, dizziness or confusion, light sensitivity, slowed reaction time, speech difficulty, nausea or vomiting, fatigue or drowsiness trouble, focusing. If you have experienced any of these symptoms after a blow to the head, seek medical attention immediately. Long-term effects of a concussion. In the immediate aftermath of a concussion, symptoms such as headaches, dizziness, nausea, confusion, fatigue, difficulty concentrating, memory problems, and irritability are common. If these symptoms persist, it could be a sign of a more serious long-term injury. Long-term effects of a concussion can include, but are not limited to, chronic headaches, light and noise sensitivity, impaired concentration and focus, depression and anxiety, balance issues, memory loss. The link between concussions and memory loss. Concussion is a type of traumatic brain injury often caused by a blow to the head. The long-term effects of concussions can be severe and can include memory loss. Recent studies are showing that there is a link between concussions and memory loss, even when other neurological issues are not present. When a person experiences a concussion, their brain does not function as well as it did prior to the injury. This includes the areas of the brain responsible for memory and learning. It can also cause changes in concentration, attention, and problem-solving skills. It is also possible that the affected areas of the brain may have difficulty forming new memories and recalling previously stored memories due to the damage caused by the concussion. If left untreated, the effects of a concussion can worsen over time. It is important to seek medical attention promptly and follow up with a doctor for any memory loss-related issues. Research. When it comes to the effects of a concussion, research suggests that memory loss is a common symptom. Studies have found that around 10% of people with concussions experience some degree of memory loss due to the brain injury. In addition to this, a meta-analysis conducted in 2019 concluded that there is a link between concussions and long-term cognitive decline, such as memory loss, cognitive deficits, and even dementia. There is statistical evidence linking concussion trauma and memory loss. A recent meta-analysis showed a correlation between concussions and long-term cognitive decline, such as memory loss, cognitive deficits, and dementia. Statistical information on the occurrence of brain trauma from concussions. Concussions, or mild traumatic brain injuries, MTBI, can have a range of long-term effects. They occur when someone experiences a blow to the head, which then causes their brain to rapidly move inside their skull. As many as 3.8 million athletes experience concussions each year, and without proper diagnosis and treatment, these injuries can cause both neurological and psychological issues. The Centers for Disease Control and Prevention, CDC, states that among high school-aged athletes, there are an estimated 173,285 sport-related concussions reported annually in the United States. For those aged 19, 25, the number rises to 288,279 reported concussions each year. These numbers show that concussions are an incredibly common injury with lasting long-term effects. Evidence linking concussion trauma and memory loss. Concussion is a form of traumatic brain injury that can occur after a violent blow to the head. It is typically caused by a car accident, sports injuries, or any other type of physical trauma. Research has shown a strong connection between concussions and memory loss. Studies have found that an estimated 20–30% of concussion patients have experienced some degree of difficulty with their memory. People who experience a severe concussion may have more difficulties with their memory than those who have experienced a mild concussion. Common symptoms of memory loss due to a concussion include difficulty concentrating, confusion, forgetfulness, and inability to remember details. It is important to note that the symptoms of memory loss can vary from person to person and may even increase or decrease over time. If you are experiencing any of these symptoms, it is important to speak with your healthcare provider as soon as possible. Prevention. Concussions can be a very serious injury, so it is important to take steps to prevent them. Here are some tips that you can use to help protect yourself and others. Wear protective headgear when participating in risky activities such as sports or cycling. Make sure that things like rugs, mats, and furniture are well secured and out of the way to prevent trips and falls. Be aware of your environment and what may cause a fall or other trauma to the head. If you experience any symptoms of a concussion, such as headache, dizziness, confusion, disorientation, or blurred vision, seek medical attention immediately. By following these safety measures, you can reduce your risk of experiencing a concussion and its potentially long-term effects, including memory loss. Treatment. For those who have experienced memory loss due to a concussion, there are various treatment options available. It is important to note that concussions can have long-term effects, and it is best to seek medical attention from a doctor as soon as possible. Once a diagnosis has been made, the doctor will recommend the best course of action for the individual. Treatment may include medications, physical and occupational therapy, lifestyle changes, and cognitive behavior therapies. It is important to understand the long-term implications of a concussion and to discuss all options with a doctor before deciding on a plan of action. Additionally, some people may benefit from seeing a counselor or psychiatrist to help them cope with the effects of a concussion. In some cases, a combination of treatments may be the most beneficial. For example, physical therapy and cognitive behavior therapy may both be used to help an individual regain lost memory functions, while lifestyle changes and counseling may help to manage the symptoms of a concussion. In any case, it is important to follow the doctor's instructions and to seek out additional resources if needed. Conclusion. Concussions can have severe and long-lasting effects, including memory loss, and it is important to take concussions seriously and seek treatment when necessary. The effects of a concussion can vary from person to person, but the symptoms and outcomes are very real and can have a major impact on day-to-day life. It is essential to understand the risks associated with sustaining a concussion and to take preventative measures and follow-up care. If you or someone you know has suffered from a concussion and is having difficulty with memory loss, contact your doctor or a specialist for guidance and assistance. There are many resources available to people who have experienced concussion-related memory loss, and it is important to find a support system that works for you. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief.